Greetings to all. We are from Group 8 and we want to present our video about healing practices of Iban community in Rumah Radin Wilson, Penebak, Layar, Betong, Sarawak. Our group members are Christopher Konglong, Elisandra anak Jacob, Nurdiana Nazira binti Sepri, Madeline Bisi anak Radin Wilson, and Clavia Tizi anak Sunil. Our research is about healing practices practiced by the Iban people from ancient to the present. Traditional healing may look similar to biomedical in treating patients, but at the same time, it is very different. This is because conventional healers use natural herbs from the field, forest, and even the surrounding area to prepare the medicine. According to Idler, 2003, traditional healing is based on spiritual or religious belief. Meanwhile, biomedicine, allopathic, relies on a person's symptoms before treatment, clinical examination, and screening to confirm a diagnosis. The differences also include technology, the methods of treatment, and medication use. Sarawak people also use traditional medicine as a primary treatment method. The Iban people also learn the standard healing practice to heal people, not to be left behind. The study also emphasized what traditional healers and patients from the Iban community have to face in terms of healing practices. Other than that, most women in the communities are manang, as they tend to learn and subsequently practice this practice. It is essential to know how traditional healing works because sometimes biomedical treatment methods cannot suit some patients. If biomedical did not work on them, they will go to the traditional healing method. Conventional medicine has its effective way of treating its patient. For example, when malaria breaks out in northeast India, healers use 68 herbs that effectively treat the disease. The purpose of this study is to identify if traditional healing practices is more effective than biomedicine. The researcher researched a small village with a community that practiced traditional healing practices. The small town is called Rumah Radin Wilson, Penebak, Layar, Betong, Sarawak, where the Iban people live. Kampung Penebak Ulu is a village that is still going through modernity. It was conducted using qualitative research methods, which are in-depth interview and online sources.
Sabang daun sumpah doon ka sela-sela kuniang ni dua lima macam enam tahu tu
serai 7 semua nak
tujuh terus re wangi
According to an herbal-based medical practitioner namely Miss Berdai Anak Daun, who is a practitioner for Batangas medicine, she used a substance given 7 flowers, which means 7 leaves of herbs, where each type of herb used in the Batangas process has its own function. Among the herbs used are Blumia balsamifera, daun sembong, which can treat diabetes and infertility, relieve inflammation, control bacteria after infection. Turmeric leaf, or its scientific name is Curcuma domestica, is used to prevent cancer, eliminate body odor, for beauty, antioxidant, and an antidote to scabies. Next is the andong leaf, sabang in Iban, or its scientific name Convallaria fruticosa, used for female hormonal health, whooping cough, and bloody urinary problems. Meanwhile, fragrant lemongrass, or its scientific name is Cymbopogon nardis randall, serve to expel wind in the body, lose weight, overcome constipation, stabilizing blood pressure, and so on. Other than rambutan leaf, which work to treat hair loss and graying hair and can be used to treat colds. Next is the bay leaf, or its scientific name Syzygium polyanthum, can promote digestion, heart health, good for nerve anti-cancer. So are some of the herbs used in the Batangas process. Women who have recently given birth, persons with chronic disease, and people who have fertility and health issues can all benefit from this medical procedure.
The process of Batangas is the healer will mix 7 herbs in a big pot full of water. After that, they will be boil or cook the herbs for several minutes. While waiting for the herbs to be fully cooked, Patient needs to be ready by taking off their clothes and wearing a sarong. When the herbs are already boiled perfectly, the healer will ask the patient to go into a mat roll with the boiled herbs inside. This process will take 10 to 15 minutes. When the Batangas process is over, the patient have to bath in the river, but they have to follow the direction of the flowing water. The advantages of herbs used in Batangas. First herb is daun sembong. It can treat diabetes, infertility, relieve inflammation, and control bacteria after infections. Second herb is turmeric leaf. It can prevent cancer, eliminate body odor. The advantages of herbs used in Batangas. First herb is daun sembong. It can treat diabetes, infertility, relieve inflammation, and control bacteria after infections. Second herb is turmeric leaf. It can prevent cancer, eliminate body odor for beauty, and an antidote to scabies. Andong health leaf, or its scientific name Calvaria verticosa, is used for women hormonal health, whooping cough, and bloody urinary problems. The fourth herb is fragrant lemongrass, or its scientific name Cymbopogon mardis randall, serve as to expel wind in the body, lose weight, overcome constipation, and to stabilize blood pressure. Fifth herb is rambutan leaf. It can work to treat hair loss and graying hair. Also, it can be used to treat cold. Sixth herb is Zygesium polyanthum, or what we normally call it as bay leaf, can promote digestion, heart health, and good for nerves. And lastly, umbang pao. Umbang pao is used for allergy.
The average Iban community still practice and uses their traditional healing practices in curing disease. People in rural areas find ways to treat sick people by doing the traditional treatment. Traditional healing practices in society were very important as the main sources of medicine of the population in the past. These traditional healing practices existed before the emergence of a modern medicine. Even they still make this traditional medicine as an additional alternative to cure disease that cannot be cured by modern medicine. The average Iban community in rural areas still uses and practices traditional medicine based on mantra and biomedicine. For example, they use herb to mix to become the ingredient to the biomedicine. This herb can help to prevent cancer, treat diabetes, and other disease. Besides that, it also can be used in beauty purpose. In conclusion, we must be pleased to carry on the tradition of using traditional medicine to heal ailments because traditional medicine can also help cure disease.
Ubat pada rekuang. Tanya berkini cara ngubat orang anaknya.
Ubat ya, unsutnya.
Unsut berkuang lah. Nama tay dalam kena dalamnya minyak.
Nanti kena
Minyak.
itu aja. Nanti penting atau makai temiyang.
Nanti udah berobat. Nanti banyak berobat. Berkini dah. Berkini ngubat orang.
Berobat minyak itu.
Au.
Atau makai temiyang, makai tainya tuno dah tahu.
Orang aku nama bagi ubat Iban ke kalau kena nuan. Au. Udah ngena ubatnya nama kesan ngai nuan. Au.
Penyakitnya sangkut paut ubatnya. Gerai.
Nanti endak sangkut paut ngau sakit kitanya endak gerai merti.
Tiap pemimpi ngau penyakit tai dia.
Iya kegerai tau kendau no. Endak ngacau kita ya bang.
The last one is discuss social issues and cultural phenomena using interdisciplinary approaches. Current development have brought a modern elements in the life of the society, especially in terms of culture. This can be seen when many among the Iban community in Sarawak no longer maintain the original design of their longhouse. For example, they have modernized the structure of the house from using wooden floors and pillars to cemented floors. It is true that they still practice the traditional elements of a row, but it has been influenced by modern elements. Quite a pity actually, because the uniqueness of the traditional structure of the Iban longhouse is a part of their cultural identity.